Commune living in rural regions are at elevated danger of COVID-19, a holistic vision. Commune living in rural regions are at elevated danger of COVID-19 because they are lower to be employed and as well more likely on depressed incomes than commune living in other regions. They also face considerable barriers to evaluating patronage, containing supplier shortages, prolonged journey distances to suppliers, and modern closures of rustic hospitals. Domestic rural health patronage frameworks are weak. When one facility ends or a supplier leaves, it can influence patronage and arrival to patronage throughout the society. Health departments, local hospitals, and faith-founded institutions oftentimes are linked to society health urgencies that present services like installing safety tools in houses, supplying food resources, helping behavioral health treatment and evaluation, and supplying vaccination, transportation, and other advantages to depressed income families and persons. The closing of rural health patronage departments or the stopping of services can negatively influence arrival to health patronage in a rural society. Commune in rural regions who get ill with COVID-19 own less hospitals to handle them. Matched with urbanized hospitals, rustic hospitals are actually smaller, on a higher portion of primary patronage practitioners and a lower portion of board authenticated practitioners on their medicinal staffs, on fewer intensive patronage beds, and as well are less probable to own contracts with healthiness maintenance institutions and prefer supplier institutions. COVID-19 pandemic has driven to a global crisis. At present, everybody is concentrating on the prohibition of COVID-19 contagion, preparing and debating issues linked to physical health outcomes. The method and exercise of holism must contain an awareness of connection in order to assess convert notion of holism into significant practical perception. If conceptually conscious of elements of holism, which differ how inclusive it was recognized to be for each contributor and their connections, they can be contained into assessment. The assurance on holism to encourage health and develop overall tasks cannot be objectively measured via focusing on egg alone. The notion of holism is not modern to the universe of healthcare in other countries, but in the exercise of conventional Western medicine. Holism is until now emerging. Holism is containing the whole being, body, mind, and soul, admitting that the totality is more than a total of the portions. As we proceed forward, we realize that the pandemic persists. To develop and the health patronage society must carry on to grant high-quality patronage to all patients. As the universe replies to COVID-19, the function of general health in confirming the delivery of fair health patronage in rural societies has not been completely respected. The effect of such crises is aroused in rural societies. Many thanks for your watching. I am Maram Shtaya, a UN online volunteer at Wamolo International.